Deep vein thrombosis, DVT, a disorder involving a thrombus in a deep vein, most commonly the ileac and femoral veins. It occurs in at least 5% of all surgical patients, more serious than superficial thrombophlebitis because of the risk for pulmonary embolism. A patient with DVT may be asymptomatic, but they can also experience possible unilateral edema in the affected leg, pain, warm skin, and erythema. However, if the calf is involved, tenderness will be present. As a nurse, it is important to provide initial bed rest for the patient due to pain. However, as soon as the patient can tolerate it, encourage them to ambulate as prescribed. To help reduce swelling, elevate the affected extremity above the level of the heart and administer intermittent or continuous warm moist compresses to the affected leg. The nurse should assess neurovascular signs of the affected limb, including color, warmth, motor movement, sensation, capillary refill, and pedal pulses. Additionally, apply anti-embolic stockings as prescribed, typically after edema subsides, to reduce venous stasis and assist in venous return to the heart. Advise the patient to avoid putting pillows under the knee and to refrain from massaging the extremity. It is crucial to monitor for sudden shortness of breath and chest pain, which could indicate a possible pulmonary embolism. Medical interventions begin with thrombolytic therapy, such as TPA, aimed at dissolving the blood clot, and should be initiated within 5 days after the onset of symptoms. The doctor will also prescribe heparin therapy to prevent the enlargement of the existing clot and the formation of new clots. Warfarin therapy will be given following heparin therapy once symptoms of DVT have resolved. Warfarin is slow-acting, taking 3 to 5 days to reach its therapeutic effect. Therefore, it can be administered along with heparin before the heparin is discontinued. It is also important to relieve the patient's pain by administering analgesics. Lastly, diuretics will be given to reduce lower extremity edema, with measurements taken of the circumference of the thighs and calves. In theory, Virchow's triad outlines 3 factors that predispose a person to develop vascular thrombosis. These factors encompass vascular trauma, increased coagulation, and reduced blood flow. Vascular trauma can arise from various sources, including abdominal and pelvic surgery, for example, gynecological or urological procedures, venipuncture, fractures of the pelvis, hip or leg, trauma, the presence of an indwelling femoral vein catheter, and a history of previous DVT. Potential causes of increased coagulation include cigarette smoking, dehydration or malnutrition, oral contraceptives, particularly prevalent in women over 35 years old who smoke cigarettes, high-dose estrogen therapy, and polycythemia vera. Factors contributing to reduced blood flow encompass pregnancy and the postpartum period, prolonged immobility such as bed rest or due to a fractured leg or hip, long trips without exercise, spinal cord injury, stroke, advanced age, and orthopedic surgery. Additionally, obesity, varicose veins, atrial fibrillation, and congestive heart failure can all diminish blood flow. Pulmonary embolism occurs when arteries in the lungs are blocked by a blood clot from deep vein thrombosis. This clot obstructs blood flow, causing symptoms like chest pain, shortness of breath, rapid heartbeat, and sometimes coughing up blood. If not promptly diagnosed and treated, pulmonary embolism can be life-threatening. To diagnose DVT, a venous Doppler evaluation helps determine venous flow in deep femoral, popliteal, and posterior tibial veins, while duplex scanning locates and assesses the extent of thrombus within veins, ultrasound imaging plus Doppler. Additionally, a venogram, phlebogram, may be performed to pinpoint the location and extent of clot using contrast media. A spiral CT scan provides continuous slices, enabling visualization of entire anatomical areas, such as the lungs, to detect pulmonary embolism. A D-dimer test elevation may suggest pulmonary embolus, though it's not diagnostic. Lastly, platelet count, bleeding time, INR, and APTT may show possible alterations due to drug therapy. As a nurse, it's crucial to educate patients about the risks of anticoagulation therapy. This includes teaching them to recognize signs of bleeding, such as ecchymosis, gum and nosebleeds, and hematuria. Emphasize the importance of regular blood tests to monitor PT, APTT, and INR levels. Advise using electric razors and soft bristled toothbrushes to minimize bleeding risk. Encourage avoiding aspirin, NSAIDs, and certain herbs like garlic, ginseng, and ginkgo biloba. Caution against contact sports and advise against increasing intake of foods rich in vitamin K, such as broccoli and cabbage, as they can decrease the effect of Coumadin. Also, advise against consuming grapefruit, which can increase bleeding risk. Ensure that dentists and other healthcare providers are aware of the patient's anticoagulant therapy. If possible, avoid intramuscular injections. Additionally, emphasize the importance of wearing a medical alert bracelet at all times. The nurse should also advise the patient to avoid prolonged sitting or standing, crossing legs when seated, and wearing constrictive clothing. It's important to elevate the legs for 10 to 20 minutes every few hours each day and to follow a progressive walking program. Regularly checking the legs for edema and measuring leg circumference is recommended, as is wearing anti-embolism stockings as prescribed. Lastly, the patient should avoid smoking.